Myself, Dr. Amol Kumar Jadhav, consultant pediatric neurologist working in Ankura Hospital, Hyderabad. So today we are going to discuss about pediatric neurology, common topics, common questions which people face, and those are the common neurological disorders in the children. So we are here to discuss all those things. So pediatric neurology comprises of various disorders like headache, migraine disorders, pediatric epilepsies, neuromuscular disorders, neurometabolic disorders, pediatric strokes. So these are the disorders which we see as a pediatric neurologist on a day-to-day basis. So headache is a very common disorder nowadays in the children. Initially used to be considered in old age and adolescent age group, but now early age group also have symptoms of headaches. We need to understand why these headaches are rising in the children, because they're lacking good sleep habits, they're not taking enough sleep, they're not hydrated well, they're not taking rest, they're using more screen, and along with that they are burdened with a lot of work from school, and they're stressed because of surrounding pressure, the peer pressure, and the social atmosphere and environment is not that feasible for their proper growth. So pediatric epilepsy again is a big challenges. Managing pediatric epilepsy is really challenging nowadays, because many disorders are coming up with newer genetic mutations, and we need to understand the proper genetic background of that condition, and we need to treat accordingly. Neurodevelopmental disorders again comprises of autism spectrum disorders and attention deficit hyperactivity disorders. In that, the child will have delayed in either of the milestones comprising of language and social milestones. In ADHD patients, the child might not be very attentive, he might have attention issues, impulsive and hyperactivity issues, and then we need to understand what the child is suffering. It's just autism spectrum disorder or attention deficit hyperactivity disorder. So managing those children are really tough and really challenging. We need to understand, we need to diagnose with the help of various tools available, and proper multidisciplinary approach containing pediatric neurologist, psychologist, occupational therapists, behavioral therapists and speech therapists together, and including psychiatrists for behavioral disturbances. Together we can do and make the difference. So genetic disorders in children. So we need to understand, because genetic disorders are inheritatory, that are coming from our parents. So we need to have a 3-generation pedigree with us. Any disorders like be first degree, second degree, third degree, those are related to various disorders including neurological disorders. So many a times we don't understand, we marriage in a close relation, and we have to face various consequences in the form of various challenges in the neurological illnesses and genetic and metabolic disorders. So it comprises of large group of disorders, and it affects either of the system, starting from brain, heart, lung, kidney and liver. Major organs are affected because of underlying genetic disturbances in the individual.
Can you tell us about your background and what inspired you pursue and career in pediatric neurology?
So during my pediatric training, I came across various neurological diseases in the children, and I was very fascinated understanding complexity in the neurological illness. And because the diagnosis of neurological illness is very tricky and it is challenging, so solving that kind of puzzle makes you interesting in that particular subject.
Okay. How do you stay current and the latest developments?
So when we come across pediatric neurology training, as a part of training and as a part of clinical practice, we always has to go attend workshops, participate in various CMEs, attend national and international conferences. So I do attend frequently various national international conferences. I am connected with multiple persons, multiple practitioners over a period of years. I am in touch with my colleagues all over the globe.
What do you believe are the most significant challenges facing pediatric neurology today?
So the diagnostic dilemma, sometimes the diagnosis will be delayed, sometimes it is not precise, and diagnosis and treatment is sometimes not accessible in all the population. So making early diagnosis, giving a right treatment and make it accessible to all general population, that is our main aim to go ahead with the treatment.
Can you describe a particularly challenge case you are encountered in your practice? How you manage?
So few months back I have seen one interesting case of glutaric aciduria. So initially the child was treated as benign epilepsy of infancy. Child was getting frequent myoclonic jerks and he was not responding. With multiple refractory seizures, the child has presented to me. After thorough investigation and clinical history, it made me to understand it is something else, and I have underwent a few genetic and metabolic testing. After that, I came to conclusion that this is metabolic epilepsy and we need to treat in a different way. I have started on dietary therapy and related medications. So the child is doing well, the developmental outcome is better, and this is the what we have to understand. Every case is not same. Sometimes we have challenges in diagnosing different conditions. Based on a clinical history and thorough examination and relevant investigation will make it easy to understand the case and the disease.
How do you approach diagnosing and treatment complex neurological conditions in children?
So going for any neurological case, we need to understand the clinical history, thorough physical examination and relevant investigation. With the help of all this trio, then we'll understand better and we can diagnose each neurological condition. It's absolutely essential to have a multidisciplinary approach in diagnosing particular cases like cerebral palsy, where physiotherapists, occupational therapists and pediatric orthopedicians also has a role in managing these kind of conditions. Sometimes complex neurological disorders has very difficult names in pronunciation, and patient doesn't understand what it is actually. So I try to make it simplify and make them understand what it is and how we are diagnosing that condition, how we are approaching the case. Once they feel comfortable and being trustful on the doctor, then I start my treatment very much tailored for the particular condition and particular disease. And it's not same for all individuals. It will be based on particular case, particular symptoms and physical and clinical examination and neurological details, whatever I found on that case. So based on that, I'll design the treatment for that patient.
What is the epilepsy? Can you describe the ADHD?
So epilepsy, what we are saying is its tendency to have recurrent episodes of seizures. So it might be present in various age groups, be a neonate, infant, childhood, adolescent, even in older people. So diagnosing epilepsy makes us sometimes very challenging. We need to make it in a diagnostic format. We have to diagnose the syndrome and then we have to tailor proper investigation and treatment part of it. So what I do is video EEGs I do to understand the seizure semiology and to understand how the seizures are happening and when at particular time, particularly in a daytime or in the night, at what time makes the child come discomfort and then this kind of seizures are happening. So video EEG will able to understand the exact seizure semiology. It is very important to undergo for a pre-surgical evaluation, and based on the findings and the exact seizure semiology, will plan accordingly and will start on a particular anti-seizure medication in that condition.
Sir, what is the EEGs and EMGs?
So EEG is a test which diagnoses epilepsy, which detects if the child is having a seizure or not, or any abnormal movement looking like seizure will be able to understand better with the video EEG, and we can understand it's really seizure or not. And EMG is a test where we diagnose a nerve and muscle related disorder, basically spinomuscular atrophy, neuropathies, muscular dystrophies will be diagnosed on electromyography. For the children and the parents, I would like to advise do proper exercise and yoga, breathing techniques, so that it will relax your mind, and take your meal on proper time, so that you will not get episodes of headache or syncopal attacks when you are at home, or you are at office, or you are at school. Anytime, anywhere, you can get this kind of episodes where you feel dizzy, you feel like falling apart. So in that case, to avoid that, take a proper hydration, rest, and good amount of meal. Balanced food is required. Many disorders come genetically, inherited through various modalities from parents to next generation. My message to the parents are, and the practitioners, diagnose early, make it accessible. The neurological health is at most important. Our child is a unique child, and it's our child, so we need to understand what is wrong with the child. We have to observe, we have to spend time with the child, and any abnormality or any abnormal behavior of the child could be concerning. Please show to your neurologist.